If, however, it's just the outcome of people being at home for Christmas and then when they get back to work, it'll grow again. We won't know, and we can't know that for a couple of weeks. The second thing is that people keep talking, and the mainstream media and the government all repeat this sin as though apples and oranges were the same. The Omicron virus is massively less harmful than the Delta virus, and it's displacing it. One scientist actually described it as nature's vaccine. So we perhaps should be a little bit less nervous of it. Now, what's going on with the pupils in schools, I think, is the government is trying to avoid the problem it's already seeing in the health service, which is the staff effectively isolating at home, and that crippling the provision of the public service. And people are very worried, and I think Nadeem Zahawi is quite rightly worried about not harming the education of yet another generation of children. So my view, I'm really rather with Professor Russell, you cited earlier, who said, OK, let's go with this, but let's be very clear to keep an eye on it and stop requiring masks the moment the evidence indicates we can relax on it, the moment. Because you're quite right, it's uncertain as to whether masks help. They probably help a bit, but they certainly are not a solution to the problem.
I think there's relatively strong evidence that they do help decrease the spread, but not by a huge amount. I wonder, we've heard all of these phrases before, 3 weeks to flatten the curve. We were told that the lockdown last year would only be a month or two, and it's stretched in one form or another through to the summer. What confidence do we have in these mask measures in schools, making sure that they are sunsetted, making sure that they don't just go on and are extended, as with so many previous coronavirus restrictions before them?
Yeah, well, you're right in the first part of your comments. I mean, many of the measures were taken in the early part of COVID were probably entirely ineffective. Many of the lockdown measures almost certainly came after the peaks anyway. And masks, well, there's various data. There's very little observational data. There were some experiments done which showed that masks sort of cut transmission by 75%. If I'm the person carrying the disease and I wear a mask, I protect you. It doesn't protect you wearing a mask, doesn't protect you from me, as it were, or not so much. So will they back down? Will they reverse the policy? Actually, this time I think they will. You're dead right again. The cabinet has been for a year and a half altogether too supine in the face of data which was often wrong, theories which were often wrong, assessments by scientists which were essentially very safety first. They gave worst case scenarios and didn't point it out and let people think that they were forecasts. All of that has, I think, made the cabinet, for the first time in 18 months, actually stand up to it a bit and say, no, we want to see the data properly. We want to understand it properly. We don't, if it's not necessary to do something, then it's necessary not to do it, and that's true of masks. And so we saw that just before Christmas, the cabinet standing up to the advocates of security first, if you like. And I think this time around, everybody's going to be looking very, very carefully at the data and seeing what happens.